What if a disease affecting thousands every year could begin with symptoms that look just like malaria or the flu? Today, we are talking about Lassa fever, a viral illness that continues to challenge health systems, especially in West Africa, yet remains unfamiliar to many around the world. Hello, everyone. Welcome to the Global Health Pharmacist Podcast, where we break down complex health issues into conversations that inform, empower, and spark action. Yes, this is an episode in the disease prevention series. In this episode, we'll explore what Lassa fever is, the symptoms to watch for, who is most at risk, and the practical steps people and communities can take to stay safe, plus a look at how treatment works today. Let's start with the basics. What exactly is Lassa fever and why does it continue to make headlines? Lassa fever is a viral hemorrhagic illness caused by the Lassa virus. It was discovered in 1969 in Lassa, Borno State, Nigeria. That's how the name Lassa fever came about. It's primarily spread through contact with food or household items contaminated by rodents. Rodents, especially rats, are household pests, right? They are the carriers of this virus, and they transmit it to humans through foods like grains, but it can also spread between people, especially in healthcare settings without proper infection control. It often peaks in dry season, that is between November and April. This is how it spreads. First, it spreads from rodents to humans through direct contact with rat urine, feces, saliva, or blood. Through contaminated food, when rats crawl over them, or by inhalation from sweeping floors where rat droppings are dried into dust. Also, it is transmitted from human to human through direct contact with body fluids like blood, vomit, or urine of an infected person. Note that it is not spread through casual contacts like hugging or shaking hands unless there are open sores or fluids involved. Every time there is an outbreak, it reminds us how closely human health is tied to environment, housing conditions, and public awareness. Although it is often discussed during outbreaks, Lassa fever is not new. It is a recurring public health concern that requires constant vigilance. One of the biggest challenges with Lassa fever is that it doesn't always look dangerous at first, which brings us to symptoms. Early symptoms can be so subtle and unrecognizable. They include fever, weakness, headache, muscle pain, or sore throat. Because these signs resemble many common illnesses like malaria or flu, people may delay seeking care. Another challenge is misdiagnosis. In regions where malaria and typhoid are common, Lassa fever may initially be mistaken for these other diseases, so treatment may not address the causal organism. But access to good laboratories and experienced health personnel help, which is why it is advised that if your fever persists for more than 48 hours after you've used medication, it's time to visit a healthcare facility. In some cases, however, symptoms can progress to vomiting, facial swelling, chest pain, difficulty breathing, or bleeding complications. These bleeding complications involve bleeding from the nose, from the mouth, or the eyes. It takes 3 to 21 days, that is within 3 weeks, for symptoms to show after contact. Besides, not everyone experiences severe disease, but early recognition makes a significant difference in outcomes. So, who faces the highest risk and why do outbreaks keep happening? Risk isn't just about exposure. It's shaped by living conditions, work environment, and access to healthcare. People living in areas where rodents easily enter homes are at higher risk. Healthcare workers may also face exposure, especially when protective equipment or training is limited. Seasonal patterns, food storage practices, and overcrowded housing can all contribute to transmission. And like many global health challenges, Social and economic factors often determine who is most vulnerable. People in rural areas who do not have access to healthcare facilities, they are most vulnerable compared to people in urban centers. The good news is that many infections can be prevented, and prevention starts with everyday habits. Preventing Lassa fever isn't about one big solution, it's about small, consistent actions. Personal and environmental hygiene, safe food storage, proper waste disposal, and reducing rodent access to homes can make a significant difference. Always ensure to store your food properly, preferably in closed, airtight containers. Avoid drying food outside in open spaces, and also block holes which can give rodents access to your home. In healthcare settings, infection prevention and control practices protect both patients and healthcare providers. Prevention is where individuals, communities, and health systems truly come together. A reminder that public health is a shared responsibility. Community education also plays a major role. When people understand how the virus spreads, they are more likely to seek care early and avoid risky exposure. Which is why I'm sharing this with you, so that you also can share it with others. Therefore, share this episode with as many people as possible. But what happens if someone does become infected? Let's talk about treatment. Treatment focuses heavily on early diagnosis and supportive medical care. The earlier someone receives attention from trained healthcare professionals, the better the chances of recovery. Managing symptoms, maintaining hydration, and monitoring complications are all part of care. This cannot be done at home. There's also an antiviral medication used to treat this disease called ribavirin. This is not your usual over-the-counter medication, so do not have it in mind that you can get it yourself. You have to visit a healthcare facility to be treated appropriately with it. While researchers continue to explore improved therapies and strategies to strengthen outbreak response, it is your responsibility to take preventative measures and spread awareness about the disease. But then, global health challenges still persist, especially in low and middle income countries. Access to treatment, however, still remains uneven. This highlights the ongoing need for investment in health systems, laboratory capacity, and trained personnel. And that leads us to the bigger global health picture. Lassa fever reminds us that infectious diseases don't exist in isolation. Surveillance, preparedness, and collaboration between countries are essential. We talked about pandemic preparedness earlier on this podcast. I've left the link somewhere so you can go ahead and listen to that as well. While it is currently endemic to West Africa, especially Nigeria, people travel every day and it can easily cross borders, becoming a pandemic. Remember that it can be transmitted from human to human. Therefore, pharmacists, clinicians, researchers, and community health workers all play a role in detection, education, and response, while the members of the community have to take preventative measures, like I've said. Strengthening systems today helps prevent larger crises tomorrow. Remember that I always say prevention is better than cure. And yes, it is. So here's what to remember. Lassa fever may begin with familiar symptoms, but awareness, prevention, and early care can save lives. Use rat traps, poisons, and gums in your homes. Avoid killing rats with sticks or cutlasses, where you may get their blood spilled on you or their debris on the floor or in the air. Check your food stores. If you have grains in open bags, move them to containers. Block holes in your home. It could save your life. If you found this episode helpful, share it with someone who wants to understand global health beyond the headlines. And don't forget to follow the podcast for more conversations that connect science, policy, and real-world impact. That's all on today's episode. Thank you for listening up to this point. I hope you got value and are going to take preventative steps against Lassa fever from now on. Support the podcast with your subscription, likes, comments, and shares. Follow on all social media platforms as well. Till next time, stay healthy and God bless you. Bye.